So question here, an elderly client is hospitalized for a transurethral prostatectomy. So removal of the prostate gland. Which findings should be reported to the doctor immediately? Number one, hourly urine output 40 to 50 cc. Number B, bright red urine with mini clot. Number C, dark red urine with a few clot. Number D, request for the pain medication every 4 hours. So the answer B is correct. So bright red urine with mini clot need to report to the doctor. Why? Bright red bleeding with mini clot indicate arterial bleeding that is require surgical intervention. So answer A is within the normal limit because urine output per hour 40 to 50 cc is okay. Answer C, dark red urine indicate a venous blood, which can be managed by nursing intervention. And answer D does not indicate excessive need for pain management that require the doctor's attention. Therefore, they are incorrect. Next here, which statement by the patient of a child with sickle cell anemia indicate an understanding of the disease? So examiner asking the question about sickle cell anemia. For sickle cell anemia, out of 4, which one is correct? So the pain he has is due to presence of too many red blood cells. B, he will be able to go snow skiing with his friends as long as he stays warm. Number C, he will need extra fluid in summer to prevent dehydration. And number D, there is a very little chance that his brother will have sickle cell. So the correct answer is number C. So if patient say this, means your patient has a good sense about the sickle cell anemia. So the child will need additional fluid, extra fluid in summer to prevent dehydration, because dehydration that could lead to a sickle cell crisis. So it is good to prevent dehydration. So answer A is not a true statement, and therefore it is incorrect. Answer B is incorrect because the activity will create a greater oxygen demand and precipitate sickle cell crisis. And answer D is not true statement, therefore it is incorrect. And 39, a toddler with the otitis media has just completed antibiotic therapy. A recheck appointment should be made too. So examiner asking this question about otitis media. So number A, determined whether the ear infection has affected her hearing. Number B, make sure that she has taken all the antibiotics. Number C, document that the infection has commonly cleared. And number D, obtain a new prescription in case the infection is occurred. So the answer C is correct, right? Documents that the infection has completely cleared, right? Completely okay. So the client should be assessed, or client should be assessment following completion of antibiotic therapy to determine whether the infection has clear or not. So the answer A would be answer A would be done if there are repeated instances of otitis media. Answer B is incorrect because it will not determine whether the child has completed the medication or not. Answer D is incorrect because the purpose of recheck is to determine whether the infection is gone. So next question here. A 9-year-old is admitted with suspected rheumatoid rheumatic fever. Which findings suggest of Sydenham-chorea? So the patient who have rheumatic fever, they have a characteristics movement of the limb we call Sydenham-chorea. So which one suggests of Sydenham-chorea? Number one, irregular movement of the extremities and facial grimace. Number B, painless swelling over the extensor surface of the joint, faint area of the red demarcations over back and abdomen. Number D, swelling, inflammation, and effusion of the joint. So the correct answer is A. Sydenham-chorea. What does it mean? It means irregular movement of extremities. So the child with Sydenham-chorea will exhibit irregular movement of extremity or facial grimaces, and also labile mood. Answer B is incorrect because it described subcutaneous nodules. Answer C is incorrect because it described erythema marginatum. And answer D is incorrect because it described migratory arthritis. What next? A child with croup is placed in a cool, high humidity tent connecting to the room air. The primary purpose of the tent is, number A, prevent insensible water loss. Number B, provide a moist environment with oxygen at 30%. Number C, prevent dehydration and reduce the fever. Number D, liquefy secretions and receive laryngeal spasm. So number D is correct answer. So liquefy secretions and receive laryngeal spasm. So the primary lesson for placing a child with the croup under a mist tent is to liquefy secretion and relieve the laryngeal spasm. So answer A, B, and C are inaccurate statement. Therefore, they are incorrect. Next question here. So the nurse is suctioning the tracheostomy of an adult client. The recommendation special setting for performing tracheostomy suction on adult client is 40 to 60 millimeter of mercury. Number B, 60 to 80 millimeter of mercury. Number C, 80 to 120 millimeter of mercury. And D, 122 and 40 millimeter of mercury. The answer C is correct. It should be 80 to 120 millimeter of mercury. So the recommended setting for performing tracheostomy suctioning on the adult client is 80 to 120 millimeter of mercury. Answer A, B are incorrect because the amount of suction is too low. The answer D is incorrect because the amount of suction is also excessive. What else? A client is admitted with a diagnosis of myxedema. The initial assessment of the client would reveal the symptoms of what? Slow pulse rate, weight loss, diarrhea, and cardiac failure. Number B, weight gain, lethargy, or slow speech, decreased respiratory rate. Number C, rapid pulse, constipation, and bulging eye. Number D, decrease the body temperature, weight loss, and increased respiration. So the correct answer, weight gain, lethargy, slow speech, and decrease the respiratory rate. So symptoms of myxedema include weight gain, patient complain lethargy, slow of speech, and decrease the respiratory rate. So answer A or D do not describe the symptoms associated with myxedema. Therefore, they are incorrect. Answer C describe the symptoms associated with Graves' disease, rapid pulse, constipation, bulging eye. This is the hyperthyroidism or Graves' disease. Next question, which statement describe contagious stage of varicella? So varicella is an infection which is highly contagious. Number one, contagious stage is 1 day before the onset of rash until appearance of vesicle. Number B, contagious stage lasts during the vesicular and casting stage of the lesion. Number C, contagious stage is from onset of rash until the rash disappears. Number D, contagious stage is 1 day before onset of the rash until all of the lesions are crusted. So the correct answer is number D, right? So the contagious stage of varicella begins 24 hours before the onset of the rash and lasts until all of the lesions are casted. So answer A, B, and C are inaccurate regarding the time of contagious. The nurse is reviewing the result of a sweet test taken from a child with cystic fibrosis. So the disease about the cystic fibrosis, which findings support the client diagnosis. A sweat potassium concentration less than 40 milliequivalent per liter. Number B, a sweat chloride concentration greater than 60 milliequivalent per liter. And number C, a sweat potassium concentration greater than 40 milliequivalent per liter. And number D, a sweat chloride concentration less than 40 milliequivalent per liter. The correct answer is number B. So the sweat chloride concentration greater than 60 milliequivalent per liter. So the child with cystic fibrosis has sweat concentration of the chloride greater than 60 milliequivalent per liter. Answer A and answer C are incorrect because they refer to the potassium concentration that are not used in marking a diagnosis of cystic fibrosis. So potassium does not play any role to diagnose cystic fibrosis. So A and C is not an answer. Answer D is incorrect because the sweat concentration of chloride is too low to be diagnostic of cystic fibrosis. A client is labor, has an order of Demerol. Other name of Demerol is called meperidine and prescribed 75 milligram. Intramuscular to be administered 10 minutes before delivery. The nurse should do what? Wait until the client is placed on delivery table and admin the medications. Number B, question the order. Number C, give the medication intramuscular during the delivery to prevent the pain from episiotomy. And number D, give the medication as ordered. Demerol or meperidine 75 milligram. It is very strong opioid, tends to develop respiratory depressed of the mother and fetus. So question comes. So the correct answer is B. Question the order. Need to check. Do I something wrong? The nurse should question the order because administering a narcotic so close to the time of delivery can result respiratory depression in newborn. So answer A, answer C, and D are incorrect because giving the medication prior to or during delivery can cause respiratory depression in the newborn. Next here, which of the following statement described a picket stage of concrete operations? Concrete operations. So here's the reflex activity proceed to intimative behavior, initiative behavior. Number B, ability to see other point of view increase. Number C, the thought process become more logical and coherent. Number D, the ability to think abstractly leads to the logical conclusion. So the correct answer C, the thought process become more logical and coherent. So why number C is answered? So during the concrete operations, the client thought processes become more logical and coherent. Answer A, B, and D are not correct because they describe the other type of development, like sensory motor, like formal, right? So the next here, the client is admitted to the psychiatric unit and claimed to be the of an instinct that he will not be kept away from his subject. The most likely explanation of the client delusion means false belief, right? So about the delusion, which statement is true? Number one, a recreational information. Number B, a stressful event. Number C, low self-esteem. And number D, overwhelming anxiety. So the correct answer, a low self-esteem. Why it is the answer? So delusion of grandeur are associated with feeling of low self-esteem. The answer A, a recreation informations, is incorrect because recreation information, a defense mechanism, is characterized of outward emotions that are the opposite of internal feelings. Answer B, a stressful event, or answer D can cause an increase in the client delusion, but do not explain their purpose. Therefore, they are not correct.